We will next look at the posterior knee. We break the posterior knee down into three different aspects: the posterior lateral, the posterior middle, and the posterior medial. We'll talk about each aspect individually and go through the scanning techniques and sonoanatomy of these regions. It's important to go through the posterior knee in a systematic approach. The posterior knee is the most complex area of the knee and requires the most experience to do. Let's start with the posterior lateral structures. We'll be looking again at the lateral collateral ligament, the biceps femoris tendon and muscle, the peroneal nerve, and the lateral meniscus and tibiofemoral joint. Some of these structures were partially evaluated in other areas of the scan and can be looked at in greater detail from the posterior approach. Let's look at the anatomy. Let's look at the posterior aspect of the knee, particularly the lateral aspect, in greater detail. The structures we want to highlight are the lateral collateral ligament coming off the fibula, the popliteus, and the peroneal nerve, which comes off the sciatic nerve, which breaks into two branches, the peroneal and the tibial. Carefully watch the peroneal nerve as it comes down on top of the popliteus. Here we see the biceps femoris short head coming in to attach to the fibula, and on top of that, the biceps femoris long head attaching. This would be the lateral head of the gastroc as the nerve comes down, crosses over the fibula, and breaks down into its two branches, the superficial and deep peroneal nerves. Let's look at the lateral collateral ligament again in slightly greater detail, reviewing its anatomy, looking at the LCL at its insertion into the fibula, crossing the joint, and then attaching again above the popliteal hiatus on that. Important to note as we pass the geniculate arteries and the lateral joint, and very importantly the tib-fib joint as well. Again, reviewing the LCL anatomy, lateral collateral ligament coming down. It will not be seen in one probe width, so you have to toggle the probe to see the whole area. Positioning here from the posterior approach, again pointing to the popliteal hiatus and putting the distal end of the probe over the fibula. This is the seeing the ligament in greater detail at its origin and looking at the mid-substance of the ligament. Let's look at how to examine this from the prone.
Structure to see is the lateral collateral ligament again. We're going to look at it in a little different way. I prefer this way to the patient side lying. I lie the patient prone, and I put the leg in a figure 4 position here to make the ligament taut. I will then easily palpate the fibular head. I will then place the probe down in a longitudinal way, about a third of the probe over the fibula, pointing towards the popliteus in this manner. Once I place the probe down, I will then look to see the LCL, which is a very small ligament, going and attaching at the fibular head here. As I move it up, you can again see the LCL piercing the two heads of the biceps femoris tendons. One head here and another just below it in this spot. Again, that's the LCL piercing through the two heads of the bicep. I then focus on the LCL and follow it up as a thin ligament coming across, focusing on it, following it all the way up as we follow it up to its attachment again into the popliteus hiatus just above the superior rim right here.
Let's look at the biceps femoris now in greater detail. The biceps femoris is made up of two heads, the long and short head, which come together to insert primarily at the fibular head. It does have multiple other insertions, which can be complex and beyond the scope of this discussion. Let's review the anatomy of the biceps and the sonoanatomy of this. Let's look at the anatomy of the bicep, tendon, and muscle in slightly greater detail. We'll rotate our model and look at the biceps, which is situated here with its long head with its tendon, and its short head, which is primarily muscular. Let's look at those in slightly greater detail. Here we see how the bicep moves and its origin and insertion fairly well. Again, its insertion and origin, and how it moves as the primary flexor of the knee. Let's look at the sonoanatomy of the bicep. This is the short head coming in, and this is the long head, and you'll see them attaching primarily down here to the fibula. Scan position is like such. Patient is prone, angling towards the ischium. You can also look at the biceps from the side lying position as well, and some people prefer this. Let's look at how to scan this area.
The next structure we want to look at is going to be the biceps femoris and its attachment into the fibula. We're going to take the same position we just used to find the lateral collateral ligament and place the probe again over the fibular head. This time we're going to point towards its ischium. So place the probe in a longitudinal approach over the fibula, 1/3, and point towards the ischium, and you will see the bicep tendon coming in to attach at the fibular head. We can follow the bicep tendon long head up as the arrow is on, and that is the long head of the bicep. Just below the long head is the short head of the bicep, which is muscular and comes down to make a tendinous attachment with the long head to go down into the fibula and attach onto the fibula.
Let's look at this in greater detail. Biceps femoris short head, long head with its broad and short and long head attachment into the fibula here. It's also important to look at that in a short axis plane as we get very good details of the bicep short axis.
Biceps femoris tendon in a short axis approach. This is very valuable when looking for hamstring tears. What we're going to do is find it again longitudinally by again palpating the fibula, placing the probe down over the fibula, going towards the ischium, where we will see the fibula and the bicep tendon in this location. As we follow up longitudinally, we will see the short head of the bicep muscle just below it here. Watch now as I turn the probe 90 degrees on this as we line up on the bicep, tendon, and muscle in a short approach. This is the axis we want. We see the hypoechoic muscle of the biceps femoris, and we see the biceps femoris long tendon in this location right here, and just below that is the biceps muscle there. I will then follow them down, focusing on the short head and long head as they come together. They come together as a tendon, and it comes down, 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 and it will come all the way down and attach in this location. Incidentally, is the peroneal nerve sitting off in this location, which we'll visualize next.
The peroneal nerve is an important structure and very easily to locate because of its superficial nature of that. It is a branch of the sciatic arising just above the popliteal hiatus, moving distally along the medial aspect of the biceps femoris. It moves across the bicep tendon and the lateral head of the gastric to go around the fibular neck, where it then splits into its superficial and deep branches. It innervates the anterior and lateral compartments of the leg. Let's review this anatomy and talk about how we scan this area. Let's begin by using essential anatomy to look at the posterior aspect of the knee and its nerve structures. The most important is the peroneal nerve, which comes as a branch off of the sciatic nerve and comes down or on the posterior aspect of the knee, crosses the knee joint running with the biceps femoris and across the top of the fibular head and breaks into its superficial and deep branches. This nerve here is the tibial nerve, which will hook up with the peroneal nerve to form the sciatic nerve. This branch here is also another important nerve, more important in the leg, the soral nerve. We can also see how its orientation is with additional muscles as we bring in the popliteus and the short head of the biceps and the long head of the biceps, seeing how the nerve comes in and wraps around these structures as it passes the fibular head. Let's look at the nerve. It has a typical honeycomb appearance in a very superficial location. Let's look at how to scan this nerve around the leg.
Alright, the next structure we're going to look at is going to be the peroneal nerve. We're going to again go back to our landmark position that we saw with the bicep looking at the fibula. I will palpate the fibula, place the probe down in a longitudinal approach towards the ischium, and again find our bicep tendon attachment coming in here, and look at the short head of the bicep muscle below. Once I know where I'm at, again, I then bring my probe down distally till its fibula is in the center of the screen. Once it's in the center of the screen, I'm going to do a 90-degree pivot off the fibula, and I will look to see the peroneal nerve, which is sitting just up to the left in this location. I could then follow the peroneal nerve down over the fibula. As I go down, it will rise over above the fibula head here and back. Let's look at that on the screen so we can see the nerve on the screen. I am going to stop and go long again, turn 90 degrees, and the nerve will be sitting right in the middle of the screen. I will then follow the nerve down as it goes up above the fibular head in this location. I will then move my probe back to where we initially saw the nerve. We can now follow the nerve towards the popliteal hiatus and see it attached to the tibia. The nerve will go in this direction, shown this way, sliding it all the way up. In a slow way, the nerve will come across towards the popliteal hiatus and dive deep. Let me go back and we'll look on the screen as I repeat that motion. This is the nerve where we found it with the fibular head. I will then bring it up slowly towards the popliteal hiatus. The nerve will come in here, stay superficial, and then start to drop. As the nerve starts to drop, we start to see the tibial nerve coming in, and it will attach up together with the peroneal nerve and help form the sciatic in this location.
Let's look at a short video clip of that. Peroneal nerve coming down, very superficial location, and starts to dive down deep. Last but not least, we'll look at the posterior horn of the lateral meniscus and the tibiofemoral joint. These are easily seen structures in the back. A curvilinear probe will sometimes give a slightly better view of it. We're looking between the femur and the tibia for the meniscus, which is a triangular shaped structure as depicted here. Again, looking at the triangular shaped structure between the joint and the probe position. Let's take a look at how we scan this area.
The next structure we want to look at on the posterior lateral aspect of the knee is the posterior horn of the lateral meniscus. We're going to find our bony landmark of the fibula, place the probe down over the fibula. I will then come up till I see where the joint is. Once I'm in this location, I then just need to toggle the probe slightly, bring the leg up to find the lateral meniscus sitting in this triangle here. We can see the lateral meniscus and parts of the lateral collateral ligament above it, but this triangle is the lateral meniscus. I can then sometimes even do some rotary tests on it, just like this, to try to bring out subtle problems within the meniscus.
That will conclude the posterior lateral aspect of the knee. We'll discuss the posterior medial and the posterior middle sections next.